So as you know, the province-wide emergency declaration and stay-at-home order are still in effect until May 20th. However, we have seen some newspaper reporting that the Ontario government is currently looking into potentially extending it. They have not confirmed that, but sources are currently saying it may be until at least June 2nd. So we'll let council members know as soon as we hear more on that. Yesterday on Twitter, Canada's Chief Public Health Officer said that infection rates remain high in many parts of the country and urged people to maintain the public health measures even if they've been vaccinated. I think that's a salient point, is just to remind folks that even if you have been vaccinated, you should still be following public health measures. And then here in Niagara, Niagara Health continues to deal with increasing pressure on its ICU capacity. So it is very important that we remain diligent until everyone is immunized. We also had an announcement that the province has indicated the eligibility to receive the COVID-19 vaccine is expanding this week. So as of tomorrow at 8 a.m., individuals who are deemed to have at-risk health conditions, so things like dementia, diabetes, sickle cell disease, as well as the group 2 of people who can't work from home, and that would include grocery store employees, restaurant and transportation workers. They would now be eligible to book an appointment. So that has expanded the program. In addition, as of Thursday at 8 a.m., individuals turning 40 and over in 2021 in non-hotspot communities now are also eligible to book an appointment to receive their vaccine. So as we've mentioned many times before, but I'll just reiterate, individuals can schedule the appointment through the province online booking system or by making a phone call to their number. So this is building on the eligibility that I mentioned in my update last week, where those aged 18 and over in hotspot areas could begin as per the announcement on May 2nd. We had a couple of other announcements this week. So on May 7th, we learned that free rapid tests are available for small and medium-sized businesses that have under 150 employees. So the Ontario government, in partnership with the federal government and Ontario Chambers of Commerce, have launched that program for rapid screening. And the rapid screening initiative will provide those free rapid tests for employees of small and medium-sized businesses and participating local chambers of commerce and other organizations. The program screens for asymptomatic cases of COVID-19 in the workplace that otherwise might be missed. So that helps to keep workers and their families safe and businesses open, which is so very important right now for small business owners. This program is planned to come to Niagara-on-the-Lake to the Chamber of Commerce. So we don't have any additional details yet, but stay tuned because we will provide that information as soon as possible. In terms of the vaccine program, many of you probably already saw, but Niagara Health on May 8th, their vaccination clinic at Seymour Hanna, it just surpassed the 100,000 vaccine doses administered mark, so that was quite an accomplishment. They continue to vaccinate approximately 1,650 people per day. We also have another vaccine clinic coming to Noddle on Saturday, May 15th and Sunday, May 16th. Currently, there is limited availability left on Saturday, with more of the appointments available on Sunday. But as I mentioned earlier, with the new at-risk folks being eligible as of tomorrow at 8 a.m., those spots could fill up rather quickly. So it will be important for people to book their vaccines as soon as possible for those locations. And effective May 10th then, so today at just before noon, Niagara Region's website was updated. They're reporting that approximately 39.5% of Niagara's population have been vaccinated. And so that's just over 200,000 doses administered here in Niagara now. So 97% of the 80 plus population have been vaccinated, 96% of the 75 to 79, 87% of the 70 to 74, 79% of the 65 to 69. We have about 53% of the 55 to 59, 37% of the 50 to 54, 32% of the 45 to 49, 31% of the 40 to 44, and 17% now of the 20 to 39 years of age. So they're doing quite well in terms of getting those vaccinations in people's arms. So there are still vaccinations on the standby list. So I'll just remind folks about that in case you're not aware. To be contacted when there are extra doses of the COVID-19 vaccine at the end of the day, which often there are when people don't show up. People can register for the standby list on the website of Niagara Region. You have to be 40 to 54 years of age and able to get to the vaccine clinic within 30 minutes. So it's not a booking tool, and appointments are only offered if there are unused doses available, but it is worthwhile for folks who are in that category to register for that standby list. And this is an item we've had a couple of questions on, so I'll just bring it forward. There are some reasons why you would want to reschedule your appointment. So if you're sick or have COVID-19 symptoms already, Niagara Region is suggesting that you not get the vaccine and wait until you're better to get vaccinated. And they've also indicated that if you have had another type of vaccine, you should wait 14 days before receiving the COVID-19 vaccine. After you receive your second dose of COVID-19 vaccine, you shouldn't receive any other vaccines for 28 days. So we've had a couple of questions come to us about that. So I wanted to draw that to everyone's attention. So I'll talk about the traffic that we saw this weekend. We again, unfortunately, saw an increase in traffic over this weekend over last weekend. The total of incoming cars this Saturday and Sunday was 8,638. as compared to last week, which was 7,948 incoming cars. So that's about a 9% increase over last weekend. And then I'll give you our Bell Media campaign stats. That program is running until May 23rd. So this weekend, we saw approximately 85,000 devices enter into Noddle. That's up 10,000 from last week. So 62% were from Niagara Region, 20% from the GTA, which is an increase of 3% over last week, and 8% from Hamilton. So that's up 1% from last week. And if we look at that as it relates to Old Town, there were approximately 39,000 devices entering Old Town. That's an increase of 4,000 from last week. 60% of those are coming from Niagara Region, 25% from the GTA, and 5% from Hamilton. As expected, the Mother's Day weekend did bring a few extra folks down to the area. So despite the cooler weather, the parks and downtown areas were increasingly busy despite the stay-at-home order. Oddly enough, we had exactly the same number of parking tickets issued this weekend as we did last weekend, and that's 147 parking tickets. So staff continues to work on the weekends to ensure we are able to respond to any COVID-19 complaints that we get. The types of complaints we got this weekend were we had a garage sale where we were asked to respond. We had some people pulling down fencing around picnic tables in our park areas, and it appeared that there were some social gatherings in the parks. So that remains a concern and an area that we give extra attention to. This weekend, we also had some calls about groups of people occupying vacant patios of restaurants. So officers attended, reminded folks that they should not be gathering on patios, and all of the people on the patios obliged the request to exit the patios. Our inquiries related to short-term rentals have begun to slow down a little bit, and bylaw does continue to inspect the short-term rentals after hours on Friday evenings and by responding to any complaints there are. The greenhouse nurseries have also become a source of complaints. So residents are concerned with the number of shoppers. So bylaw has been visiting our nurseries to speak with the operators and ensure their customer counts are accurate. And a reminder that community members looking to report contraventions of any emergency orders are asked to email the COVID complaints@noddle.com. So that's monitored on a regular basis, and staff try to respond just as quickly as they can. So I'll switch to my good news stories. So the STEP challenge that I've mentioned the last couple of weeks, still prepping for that, but our registration opens on May 17th. So next week, you'll be able to register your teams. We also have the Newark Neighbors Food Drive, which is going to be taking place. So the town is helping to promote this event, and this is for porch pickup of community donations for the food drive. That will be taking place on May 15th and 16th. So sadly, we've seen a significant increase in community need for food donations during the pandemic, as we've had a record high number of families sign up for assistance, and that's very unfortunate. But we've also seen the food supply running low and a decrease since we saw on Christmas. So it's very important that folks donate if they're able to help support those folks in need. Members of the public, therefore, are invited to leave donations on their porch on May 15th and 16th, so that we can make sure that there's contactless curbside pickup. It will be done by Rotary Club volunteers as part of the Newark Neighbors Food Drive. And so if you want to arrange for pickup, you can email newarkneighbors1@gmail.com, or you can call 905-468-7498. And that's on our website as well. So I want to thank the Newark Neighbors for their support of our community in this very difficult time. And my last update is about fire and emergency services. So you may recall that as part of the approved 2021 capital budget for fire and emergency services, they completed a comprehensive replacement for all of their respiratory protection equipment for the volunteer firefighters. So that included self-contained breathing apparatus, air tanks, compressors, and fill station, as well as addressing the safe transportation of the compressed air cylinders. This project had been prioritized as part of the town's response to the ongoing COVID-19 pandemic, and it was important that the staff have that in place to help protect them. So now that equipment provides every volunteer firefighter with an assigned face piece, and that ends the practice of sharing their personal protective equipment, which obviously is very important now. And the equipment also provides modern safety features to increase the capacity for air for firefighters when they're operating inside fires. It's got better ergonomics, improved reliability, and the ability to decontaminate after use. So this investment represents a very significant improvement in health, safety, and wellness of our volunteer firefighters, which is very important. But it also improves our level of service to the community through our increased capability at emergency incidents. So we're happy to let you know that that project is now complete. And one that also supports our primary goals and our strategic plan for fire and emergency services for the optimization of the volunteer firefighter service delivery model.